Hello everybody. I am going to be joined here shortly with a very special guest that I'm super excited to have this conversation with. Hold on, a bunch of people. Wait, that's my dog running down the steps, sorry. Hope you guys didn't hear that. Can someone just give me a thumbs up if you guys can hear me okay? And I'm going to wait for Dr. Prem to join us. We are going to discuss COVID, pregnancy, the kiddos, the newborns, what to do with now that we're getting vaccinated, all that good stuff. We basically are just going to answer questions that have been submitted. Here he is. Where are you? Okay, let me find you, Doc. Okay, he's going to be joining me here soon. Oh, let me push it.
Hello,
Hello.
hello.
Hi.
Hi.
Good afternoon. How are you doing?
Good afternoon. Let me see.
Yeah. Yeah. You just got to adjust the screen just a tad. There you go. There you go. There you
Mhm.
go. Okay. I was just talking a little bit while I was waiting for you to come on. Sorry, my massive dog is, sorry. Lay down. Okay, you're good. So I was just introducing you. This is Dr. Prem. He is a neonatologist this is a long title, so I'm going to say, wait a minute. Do you have headphones on?
I don't.
Do you have headphones?
I can.
Yeah, but I'm going to take mine off then because there's a feedback. So I'm going to see if people can hear
I
me.
see.
Because sometimes, okay, can you hear me?
I can hear you perfectly. Yes.
Okay, so guys, if you're having problems hearing me or him, because if one person has headphones on and one doesn't, sometimes there's feedback. So just let me know, put in the comments if there's an issue, but I'm going to take mine off to see if that helps. Okay.
Yeah.
Yeah, so
Good.
we'll go from here. All right. So you're at Johns Hopkins All Children's Maternal and Fetal Neonatal Institute, and that is in Florida, right?
That is correct. We are. It's interesting because we are, part of Johns Hopkins. I'm an assistant professor of Johns Hopkins
Yes.
School of Medicine, but obviously we're down in Florida in the Tampa Bay area in St. Pete. So we get we get the nice beach.
If I had to pick, I'd say I'd want to be in Tampa. Okay, well, listen, we're going to jump in. The whole purpose of this conversation, Dr. Fort and myself put ahead of time, hey, if you want to submit any questions about COVID and pregnancy and the vaccination and pregnancy, plus with the kiddos, especially with the new recommendations coming out about vaccinated individuals. So basically what I've done is gone through and put up some questions, and we're going to jockey back and forth so each one of us answers. But the first thing I want to tackle right now is the new CDC guidelines for vaccinated individuals. And I'm just going to go over these real quick.
Yeah.
First, people are considered fully vaccinated if 2 weeks after their second dose in a 2-dose series, such as with the Pfizer or Moderna vaccines, or 2 weeks after a single dose vaccine, which is the Johnson & Johnson vaccine. If it has been less than 2 weeks since your first dose shot, or if you still need to get your second dose of a 2-dose vaccine, you are not fully protected. Keep taking all preventative steps, social distancing, masking, all that stuff until you are fully vaccinated. So that's what to do for people to be considered fully vaccinated. And just a reminder, there are only 3 vaccines that are available in the US. Pfizer, Moderna, 2 shots, and Johnson & Johnson, 1 shot. From what I'm hearing, and you can chime in here, it depends on where you're at as to what vaccine is available, right?
Yeah, it sounds like it. And actually, I was just finding out because I have a family member that was asking, and it also depends on the day of the week and shipment. So actually, if you look at, CVS and Publix, they're beginning to distribute, which is amazing. It's great that really all efforts are now being put into making sure that people get vaccinated. So they're allowing to be able to use those means of distribution. But it really depends what comes in that week, just like what comes in with the chicken and all the other stuff in public. So.
Yeah, and then just while we're on it, people ask me all the time, which one should I wait? Should I get the 1 dose? You get whatever vaccine's available. Whatever's available, get it. That's what I say. Do you agree?
100%, 100%. They're all extremely effective. The fact that we have these numbers in the 90s or even mid 80s to prevent severe infection is absolutely amazing for pretty much any vaccine. So they're all very effective at preventing the severe infection, which is essentially what you're trying to. If you get a cold, you get a cough, that's kind of what goes with coronavirus. As the physician and the healthcare workers are very familiar with the term coronavirus. It's existed for a long time. It has just become this COVID-19 that really is the severe illness. And so you get a cold, you get a cough, no big deal. But you want to prevent hospitalization and obviously death.
Yes, yes. Okay, so we're going to move along. These are the further going on is if you've been fully vaccinated and you've met the criteria that I just mentioned. If you have been fully vaccinated, you can gather indoors with other fully vaccinated people without wearing a mask or physical distancing. Okay? Sorry. Soleil, stop it. She's really, really attached to me. I apologize.
No, not at all. I have
Ebony,
two.
can you get Soleil? No. She's trying to drink my coffee. Dogs don't drink coffee, honey.
Oh, no.
Sorry,
Don't
guys.
drink the coffee. The coffee's for adults only.
I know. I'm sorry.
Not
This
at
does
all.
not happen. This is so unprofessional. She's right over here. She's trying to drink my coffee.
Not at all.
Grab her. Put her outside.
Dogs will do that. They're just, I have a puppy and I have an old one. And yes, you never know. I had one actually pull the wires as I was on a live. The whole phone fell out. It was, Dogs will
Okay,
do
so
that.
all right. All right. So, and I was on a roll too. All right. You can gather indoors with fully vaccinated people without wearing a mask or physical distancing. You can get indoors with unvaccinated people who are low risk from one other household. For example, visiting with relatives who all live together without wearing masks or physical distancing. Now, this is a question for you. It says you can visit indoors with unvaccinated people who are low risk. Are children considered low risk? Are newborns considered low risk?
Yeah, and by the way, we've all been waiting for these recommendations. So when they came out, there was, definitely a little mini celebration. You've got to celebrate those little wins. So going back to your specific question, when we're talking about children, yes, those would be considered low risk, again, within the category of children that do not have some immunocompromise, meaning some low defense mechanism. So if we're talking about children who are taking specific medications to bring down your immune system, either because you may have a cancer or because you have some rheumatologic disease or something that would decrease your immune system response or defense mechanisms, then those categories are definitely off limits. They would be still considered, high risk. So as far as children per se, this is wonderful because obviously there's a ton of grandparents. I can tell you personally, I have a 9 and a 12-year-old. They've been waiting to see their grandparents. So this is one of those grandparent-friendly, family-friendly things now where you can have the grandparents visit. Again, we're still doing this one household. We're not inviting a ton of family members. That's really important to point out. Your second part of the question now is newborns, and that's where it's a little bit different because obviously, especially in my world of neonatology of the NICU, those babies are still considered high risk. If you look at the CDC, it's still up to 2 years of age. So they're recommending high risk children still 2 years or below 2 years still considered to be high risk. And again, specifically in terms of neonatology, premature babies, babies that have lung disease, babies that have heart disease, or actually I didn't mention that. I talked about immunocompromised children with heart disease as well are considered high risk. So again, NICU population, unfortunately, is still considered high risk. I get a lot of the questions, when does a preemie, no longer considered a preemie, and it happens to be around that 2 years of age. So this is where if you had a 24-weeker who's now 2, you could consider that being now out of preemie stage or out of their high risk, and now also by the C also now considered low risk. So that would
2 years is the cutoff. 2 years is the magic number. If your child is over 2 years, they are considered low risk. If they're under 2 years, pretty much for any reason, especially the preemies. I had preemies that were born at 31 weeks, and although they did fine, I get the whole thing. You still consider them high risk. So to carry on, if any of these people or anyone they live with has an increased risk for severe illness or considered high risk, then you need to still, even if you're vaccinated, you still need to do mask and physical distancing. So if say I had my baby during COVID, they were preemies, they were doing fine, but my parents were vaccinated, they could come in, but I would still have them wear a mask, right?
Well, again, according to the CDC, we still want to restrict those type of visits unless, yes, for the unmasking. Yes,
Yes,
for the unmasking.
yeah.
Yes,
So they would, if they were vaccinated and they came in, they would still wear a mask. Obviously, if they're unvaccinated and you have a child under 2, especially newborn, you wouldn't want them there. But if they're fully
absolutely.
vaccinated, and they could still come in and see the kids under 2, as long as they're wearing masks and they're
You have to have all your protective, yes, and of course, even with all this, you have other family members. Yes, you're still doing
yeah.
your masking, you're still doing your washing your hands, things like that. Yeah.
And you listen. We're not quite there yet. It's getting better. You still have
Yes.
to think about every individual in the household, okay, and what their risks are. And everybody's a little bit different. You have to do, and that's where the whole single household comes in. Even in a vaccinated situation, you can't bring a bunch of different households in because you can't keep track of what everybody else has been doing. You know what goes on underneath your own roof, right? And
Absolutely.
you can't verify what your neighbors, and even though you really
Right.
like them and they seem like they're
Right.
really cool, you still cannot verify.
Right.
You still
Absolutely.
be cautious, right?
Yes, and you could even take that to the next level. If you have vaccinated grandparents that want to come see the kids, but you have an aunt who may be going under cancer treatment, who may be immunocompromised, that's probably a situation where you would want to not necessarily not have the grandparents in, but you wouldn't want them to be exposed, even though, again, the vaccination per se, there's still some data showing that it does decrease the risk of transmission, especially now if you're vaccinated, you don't tend to have the asymptomatic presentations as you see with unvaccinated, but there's still a small risk. And there's still, we'll know a lot more. As you know, every month we're just gathering a lot more data. So we'll know, 2, 3, 4 months from now whether that's true or not. But because we still don't know fully, you would probably not want those vaccinated grandparents coming in close contact with somebody who is still immunocompromised.
Right. Good. Okay, that's perfect. Now let's move along to how can we keep let's talk about newborns. How can we keep our newborns safe from getting COVID infection? And let's just talk about, the average, not necessarily preemies. I think most parents are super cautious. Let's just talk about the average term, healthy, no issue newborn. How can we keep them safe from COVID infection?
Yeah, the first thing to note, and this is extremely important, is that all the different medical governing bodies, American Academy of Pediatrics, obviously the CDC, they do not recommend the use of masks or shields less than 2 years of age. This has increased the risk of sudden infant death syndrome SIDS. There was a huge to-do several months ago when there were some magazines popping up with beautiful looking, pink shields for infants to use, and that was shut down immediately, thank God, by the medical community and several parent advocates as well. So that's point number one, no masking, no shielding for kids less than 2 years of age. The second part is really, we're going to go with the virus sort of plan, which is any type of virus, any type of exposure, you want to minimize it with children that are less than 2 years of age. As I've already mentioned, especially those newborns, and especially within the first 6 months to 9 months, those babies are considered somewhat immunocompromised, lower defense mechanisms. So that's where you do a lot of the practice that we've already talked about. From an adult standpoint, you want to make sure you mask yourself, that you're still using a mask with your baby, that you are washing your hands prior to touching the baby, after you have touched the baby, that you are washing your hands. This is the same for pumping. If you're pumping and you're using your pumping equipment, you want to wash your hands before you do so. Then do your pumping, you want to wash your hands afterwards. So it's just, again, a lot of things that, for the most part are common sense, but you want to sort of, now emphasize that, especially for a newborn or for an infant baby within less than 1 year of age. Same thing going out. If you're going to go out, you want to still maintain that 6 feet. You don't want to be going into strangers' houses. You don't want strangers to be coming. They've even, there's you can even find on Amazon and some of the other online shops, little announcements, infant baby, please do not approach, or trying to protect myself. They do these cute little things. So you can even put that on your carriage to make sure that people understand. And for the most part, most adults understand, you got a small baby, we're not going to approach, especially right now in the times of COVID. So those are the things, sort of minimize interactions with people that you either don't know or that are unvaccinated, hand washing, masking for close contacts.
Well, and the other thing is, like, for some of the states, and I live in one, where things have opened up, it does not mean that everything's back to normal. It does not. You still have to protect yourself. And I will say, Texas has opened up and we're seeing more COVID cases. Now, we're not seeing as much as we were a few months ago, but we're seeing new infections, okay? So it is still happening. So don't think just because the government or your state government says it's cool to do this and do that. And also, and I'm just going to put it out there since we're talking about it, even if the state has lifted restrictions, if that institution or that place of business still requires to wear your mask, wear your mask.
Absolutely.
And I am so grateful that most of the businesses that I've been to or near or seen are still requiring masks despite what our governor has said. So, and that's happening in other states. So still respect that. It's not working.
Absolutely. And I'll add to that too, as we talked about data coming in continuously. We really are only in the last month or two learning about variants. And so what are these variants going to have? What effect are they going to have during pregnancy? What effect are they going to have for newborns? Again, we're assuming that the variants don't necessarily cause worse disease in newborns or infants, but we don't know. And anytime you don't know, you must protect yourself, at least until we gather more data. So I agree 100% with what you said.
Good. Okay. Here's a question for me. I am trying to get pregnant, so trying to conceive within the next year, and I'm hesitant about the vaccine due to complications and side effects. Would it be best to wait until conception to get the vaccine for optimal protection of myself and my future newborn? So I get this question a lot. The purpose for anyone who's trying to it's great. I think you're frozen a little bit. Hold on. So are you, Dr. Ford, are you there?
Yes.
Okay. Yeah, you froze a little bit. Okay. So
I did.
what I
Okay.
was saying is the primary reason for trying to conceive individuals, pregnant, lactating individuals, to get the vaccine is to protect yourself first and foremost. Because even though we're getting more and more data about the potential protection or antibodies going to the baby during pregnancy and during breastfeeding, we still don't know for sure. There's no studies that says you get this amount of antibodies, you're protected for this long as a baby if you get the vaccine in pregnancy or lactation. So the primary reason is to protect yourself.
Yep.
My recommendation is, no matter where you're at in your stage, trying to conceive, pregnant, or lactating, you get it to protect yourself, and you get it as soon as it's available to you, the vaccine, okay? Now, the bonus is we are seeing that you get the vaccine in pregnancy, that the cord blood is showing antibodies, which is great. COVID-specific antibodies, IgG, which is primarily in the cord, which is in the cord blood. If it's in the cord blood, we are assuming it's in the baby's blood, which is great. Again, we don't know how protective it is and for how long it's protective. When we talk about the antibodies that we're seeing in breast milk, there was a recent study that came out that showed that there was a response. Let me back up. For breast milk, the primary protective antibodies that you get just from breastfeeding are secretory IgA antibodies. Those antibodies are passed to baby in breastfeeding, and the gut of the baby doesn't destroy them. That's why they work in breast milk, okay? This particular study showed that in breast milk you have the IgA and the IgG antibodies, which was great. However, the response to the COVID vaccine during lactation was a further increase in IgG, not necessarily in IgA. So we don't know the significance of that, because we know that IgA works best in breast milk. So does that mean the IgG is getting broken down in the gut? We don't know, okay? So we still know that the baby is likely to get some kind of antibodies in breast milk. We just don't know how protective, and if they are, how long. So at the end of the day, the primary reason to get vaccinated is to protect you. You being protected helps to protect your baby. What do you have to add to that?
Yeah, you stated it beautifully. You do have the little cherry on top that even if there's a remote chance that you're protecting your baby, that's a cherry on top in my situation, in my thought. And you bring up an excellent point. You protect yourself. And why is that really important? Because unfortunately, the deaths that we have seen, or the babies that have been born with severe respiratory distress, or have had to be hospitalized, or even more so required needing a breathing tube, all those type of categories of extremely sick newborns have really happened because the mother was sick. It's very rare, and I don't think I've read any article of any mother who was absolutely asymptomatic normal and had a newborn that was extremely sick, unless that baby was born premature. And that we do know that there's some risk of that. So if you protect yourself, if you stay healthy, if you're well, that means the likelihood that your baby will stay well is much higher. Again, nature is varied. Every baby's a little bit different. Every situation is a little bit different. So it's not 100% protective, as you already mentioned. But the likelihood that your baby's going to be sicker because if you stay healthy, it's much lower than if you are unprotected and you are sick, you're hospitalized. Then you have a higher likelihood that the baby will be born premature,
Yes.
or that the baby will have respiratory problems and beyond that.
So for those that are asking, you know, I'm trying to conceive, should I wait? No, you shouldn't, because we're in a pandemic, and you know, the vaccines are becoming available. Get your vaccine if you're trying. Don't wait till you're pregnant to get it, because you need to be protected too. So that's the recommendation by, you know, ACOG, SMFM, ASRM, all the people that are in charge of putting out recommendations for try tickets for fertility, pregnancy, and and after that, that's what the recommendation is.
And I'll know, like, if you don't mind, let me acknowledge, because one of the fears that most people have brought up is that this is a new thing. I can't believe that this was created in 1 year, and you know, there's that fear. What if things were done too quickly? What if we just went rapidly? And I want to point out that this has actually already been studied since 2003. mRNA vaccines have been looked at already since the SARS-1 first came out. And so this has taken, you know, up to about 17 years of studies to get to this point. The new thing is just basically the production and the creation of this vaccine specifically for SARS-CoV-2. But the study of mRNA vaccines has been going on for nearly 2 decades. It's been really well studied.
Yes, yes. And thanks for saying that. I always forget to say that, but it's true. It's not a new technology. Yep. It's been studied, and we had the technology there. But what happens is, in a pandemic, you get more resources, get more money dedicated to it, and things move faster. And that's what happened. It's not like we just started from scratch with the whole technology. We had the technology, but in a global pandemic, as it should, we have to pour resources, personnel, money into getting things moved along, you know, pushed along, which is what happened here. Okay, what was the next question? For you, Dr. Port, when will the COVID vaccine be tested in kids? I just heard something about that recently. What do you know?
Yeah, so it's actually already begun. There is, and I can't speak to the specific group, but if you actually go on clinicaltrials.gov, which is where we look at all the U.S. trials and also your European trials or trials around the world, you can actually see what is going on. Right now, a lot of them are active, meaning they're ready to recruit. Some of them haven't actually specifically started. They may be waiting for the hospital to get approval to begin the project, but it has been approved to get done. So most of them are in that stage. I know of one place where they have already started recruiting 12 to 16 to 18-year-olds. There's 2 studies that are looking at starting at 4 up to 16 years of age. Those, again, have not started recruitment. So what does that mean? That means really within the next month or two, that's going to begin to ramp up as bigger numbers. So we should be able to get some data within the next 6 months. The question will be, that doesn't mean that 6 months from now, suddenly kids are going to be able to get the vaccine. I get asked a lot, when will this happen? And the likelihood, and what you see in the media and listening to experts, is that we're looking at probably end of 2021 at best, but most likely we're talking about the first few months of 22 to be able to now administer. They need to look at different doses as opposed to adults. They're going to be looking at safety for different doses because different ages have different metabolism. A 4-year-old is very different than a 10-year-old, and that's very different from an 18-year-old or a 17-year-old. So that's what they're going to be looking at. That's a little bit more complicated than just testing, 25 to 35-year-olds. And so it's going to take maybe a little bit more to get there.
Yes, so which is even more important. That's why as adults, we should get vaccinated, and it helps protect our family and our young kids who aren't able to get, especially the younger ones, but even our older kids, it's important for them as well.
Absolutely.
Okay. Next question, and this is for me. Any evidence for adverse pregnancy outcomes for people who had COVID in pregnancy? So basically what I'm going to do is I'm going to summarize what ACOG just updated their document that they have had out since the very beginning. And this last update was on the 24th. Basically, they're saying available data suggests that symptomatic pregnant patients with COVID are at increased risk of more severe illness than compared to non-pregnant patients with COVID. The absolute risk for severe COVID-19 disease is still low, but the data do indicate an increased risk of ICU admission, need for mechanical ventilation, and other ventilatory support like ECMO. Also death reported in pregnant women than with who have symptomatic COVID infection when compared to symptomatic non-pregnant women. We also know that pregnant patients with comorbidities such as obesity and diabetes are even higher risk for severe illness. And then finally, we also know that, and it's similar to the general population, for Black and Hispanic individuals who are pregnant, they have disproportionately higher rates of COVID infection and death, and the risk of ICU admission was higher for pregnant Asian and Native Hawaiian Pacific Islander individuals as well. But these are due, not necessarily due to being Black, Hispanic, Native American, or Pacific Islander or Asian. It's because of the socioeconomic and health disparities, okay? But I know that's the reason why, but it is not right, but it is there, and we have to consider that as far as what your risk is in pregnancy, okay? There was a study that came out on the 19th, and this was title of the study was Any Evidence for Adverse Pregnancy Outcomes in People Who Had COVID in Pregnancy. And this was a meta-analysis that included 42 studies with 438,000+ people who were pregnant. What they found is that compared to having no COVID infection in pregnancy, COVID-19 infection in pregnancy was associated with preeclampsia, preterm birth, stillbirth. And then symptomatic COVID infection in pregnancy was associated with increased risk of cesarean delivery, preterm birth, compared to asymptomatic COVID infection in pregnancy. And then finally, if you had mild COVID infection in pregnancy compared to severe COVID infection in pregnancy, severe COVID infection in pregnancy was associated with preeclampsia, preterm birth, gestational diabetes, and low birth weight. Now, for all of these things, the preterm birth is likely related to needing to deliver the mom early in order to take care of mom. Okay, not because there was something, the baby was ill, but mom was ill, and in order to take care of her, we had to deliver babies early, which puts them in the NICU, and depending on how early they were delivered, all the associated complications that go along with having a preterm birth. Can y'all get Soleil, please? Soleil, get down. Can y'all get Soleil, please? She still wants to drink my coffee. Okay. So
I love that name, Soleil. That's good.
She's on it today. She's not going to let me have any. So it's all related to needing to take care of mom. Now, let's talk about the preeclampsia, and we're seeing more and more of that. What we know about COVID infection, and it started with what we were looking at in placentas. We know that COVID infection causes endothelial cell dysfunction. And I'm not going to go into what that means, but it's similar to what we see with preeclampsia. Preeclampsia typically affects the small vessel beds of our body, the brain, the kidneys, the lung, the placenta, the eyes, which goes along with the brain, but those types of organs in the body. So the placenta is one of those organs in pregnancy that has a bunch of small vessels, and it can cause endothelial cell dysfunction. We're also seeing something called placental fetal vascular malperfusion, which also happens with preeclampsia. So the COVID infection, the disease process, and how it causes the endothelial cell dysfunction can ultimately lead to preeclampsia in the pregnancy. So that's where that's coming from. So we're seeing more of that in people who have COVID infection. Now, I have not seen a good study that shows if you get COVID infection in the first trimester or second trimester, what's your risk of getting preeclampsia later? How remotely from the infection are you getting it? We don't really have that. But also what we're thinking of is that the effect on the placenta or having endothelial cell dysfunction or placental vascular malperfusion may also be leading to the preterm birth. Yep. Leading to stillbirth and all of that. So that kind of all plays a role together, if that makes sense. Yeah. So you're a neonatologist. What are you doing?
Yeah, no, I agree. I agree 100%. We actually, we're seeing it in children, and I don't want to get too much into MISC and all that, but you're seeing it in children. You definitely see it from the adult. The first information, the first data that we started gathering from adults as to why they were dying, you were actually finding adults that were doing fairly well for the most part. They didn't have horrid lung disease. They were doing fine. They may have been discharged, or they may have just gone to the emergency room, would go home, and then they would, unfortunately die at home during the night. And a lot of it were vascular events. And it's what you just already mentioned. The blood vessels. When we teach our residents and we teach folks, we always talk about them being pipes. Oh, the pipes in the well, they're not. As you know, they're living organisms, and so the blood vessels itself have all these messages. And once something like a virus comes in, they shoot out all these different messages, making the blood vessels more sticky, making them more prone to having emboli or little clots. And all that goes hand in hand with what you just talked about with preeclampsia. When you have extremely, extremely tiny blood vessels, that's what you end up seeing. And this preeclampsia, as you mentioned from a neonatologist standpoint, is what we see with prematurity. And you correctly stated, a lot of the time, it's actually maternal reason why the babies are having to come out premature. We know that the blood pressures are very unsafe for some of these mothers. And so we know that delivering the babies allows that risk for the mother, for all the other things that go with preeclampsia, to decrease once the baby is delivered. And then we deal with the premature baby. The great majority of premature babies that come out tend to be on the sort of a moderate to late preterm, which is around your, beyond your 32 weeks. They tend to do fairly well from a respiratory standpoint. And again, we deal with them. They may have to stay in the hospital for a little bit, but you're saving 2 lives. And this is what's really difficult about what you guys do. You're not making a decision for one person. You're making a decision for 2. Which makes it very challenging, and I respect all the OBs and MFM for that.
But what we know about COVID, and especially the lungs, depending on how severe the disease is, for any disease that affects maternal lungs when they're pregnant, sometimes the pregnancy can make it harder to where we can't ventilate or do what we need to do to get mom well, that we have to remove that from the equation. We try to make the best decision for the best outcome of mom and baby, but if they're really sick, sometimes delivery is needed. And unfortunately, that does put a premature baby in the NICU so that we can treat mom. But it's not a decision that's taken lightly. It usually requires the pediatricians, the neonatologists, the MFMs, maternal fetal medicine specialists, obstetricians making a decision together to determine, does that patient need to be delivered? If the answer is yes, then when? How much longer can we? So I don't want anybody thinking we take that decision lightly. We try not to put those babies in the NICU if we can avoid it. But unfortunately, especially in any kind of disease, and COVID's no exception, that affects the lungs, sometimes it's going to have to happen, unfortunately.
Yeah, and there is a short window for you guys to make that decision too. So unfortunately, there's some other disease or some other illnesses that you can sort of watch and wait. But what you don't want is mom's oxygen to now cause a problem to the baby's oxygen, because now you've got a double whammy: mom's disease, and now the baby comes out not only premature but also with low oxygen, and that can be a double whammy. So I know you guys always not only you do not take that decision lightly, but you also have a short window to make that decision.
True. It's one of the more difficult decisions we have to make sometimes.
Yes,
okay.
Respect.
You get this too for your breastfeeding parents. Breastfeeding and the vaccine. The answer is yes. You can get the vaccine and breastfeeding. The recommendation is to treat a breastfeeding, lactating individual the same as you would any other individual as far as getting the vaccine. Get the vaccine and lactation. Can I continue to breastfeed? Yes, you can. Do I need to pump and dump? No, you don't. And should I get the vaccine now or wait till I'm done breastfeeding? You don't have to wait. Of course, you do what you're comfortable with, but there's no reason that we know of. And we have to also consider pregnant and lactating individuals are largely lumped together, especially when it comes to any therapy, study, trial, anything, and they shouldn't be. They really shouldn't be. They're very different physiologically, very different for many reasons, okay? So the lactating individual, there's no reason to not get the vaccine, no reason to stop breastfeeding, no reason to pump and dump, no reason at all. What are your thoughts on that?
No, 100%. Yes, no, absolutely. Not only with the vaccine, and we can get into the actual having COVID-19 disease. I know that's a different entity now, but definitely as far as the vaccine is concerned, yeah, there really hasn't been evidence shown at all that there's any detrimental effect to the baby. If anything, as we talked about a little bit ago, you may actually begin to see some antibody be able to pass along. And you mentioned already as to how long that lasts, as to how protective, we don't know. But if there is even a 10% chance that there could be protection, that's the percent chance that's better than 0% chance. So you go with it. We also know that there are basically 2 huge entry points especially for newborns and babies for COVID-19, and that is the Nasopharyngeal Passageway. So obviously, if you are passing amniotic fluid and that's getting into your lungs, that's one way to enter. But the second part is the gut. And so if you have, as you already talked about, the IgA, the immunoglobulins type A, which is very typical for what you get from breastfeeding, if you are able to protect some of those entry points or entry ports for the virus in your gut, then again, there's only positive things that can come from this.
Good. Have you heard of any adverse effects on the newborn or breastfeeding infant or breastfeeding child from the mom getting the vaccine and breastfeeding?
Not at all.
Yeah, I haven't.
I have not read any report. I have not seen anything.
Yeah.
No change in the actual, I'll leave that up to you, but no change in the actual breast milk, consistency, protein, anything like that. There doesn't really seem to be any change from the actual material benefits itself. And then to outcomes to the babies, none at all. Like I said, if anything, you get no benefit from regular, good old breast milk, but there's the potential for actually getting benefit by having gotten the vaccine. So again, it's that numbers game. If you can get any type of benefit, go for it. 100% support that.
Question for me. There are some reports that the vaccine is causing sterility and others that is making them more fertile. Which one is it? It's neither. I've talked about this extensively here. There was a blog back in January when the Pfizer vaccine first came out that was done in Health and Money News, something like that, about there being similarities in the amino acid sequence of the spike protein in coronavirus, which the vaccine targets, and a placental protein called syncytin-1. That's not true. There was a very excellent blog article that was put out in conjunction with ASRM, the American Society for Reproductive Medicine. There's no reason why. Let me just say, okay, they said there's a placental protein called syncytin-1 that shares amino acid sequence with the spike protein. So if you take the vaccine to target the spike protein, it's going to target that placental protein. That makes just about as much sense because we're made of proteins. Our entire body is made of proteins. They share amino acid sequences. So why wouldn't I'm going to be a little bit funny here, and I'm not trying to disparage anybody, but if I got the COVID vaccine and that vaccine shares amino acid sequences with other proteins in my body, then I should just melt on the spot. That's the thing. You can't just say it's just this one protein, a placenta, that has the same amino acid sequence, which it doesn't, because it probably shares amino acid sequence with a lot of other proteins that we're not anything else. So think about it that way. So unfortunately, that one blog, though, which is retracted, taken down, and has been disproven as biologically implausible or unable to happen, has caused widespread panic in those trying to conceive and those who are not necessarily trying to conceive but wanting to have children in the future. There is no reason not to get the vaccine if you're trying to conceive or want to conceive in the future. The American Society for Reproductive Medicine has even backed this. They just put out a new update, which I have in my COVID highlights under fertility, that further endorses that and further says we still recommend that. It does not cause sterility or problems with future fertility, but it's been something, and I get it. You talk about someone's fertility, it's hard to combat that, but we're still combating it, and we will continue to combat that. The evidence is not there. So if you're trying to conceive and or wanting to conceive in the future, there's no reason not to get the vaccine. Okay. Yeah,
and there's a lot of coincidental reports, and obviously people will come out and say, "Gosh, I've been trying to conceive for 5 years. I got the vaccine, and the next week I, suddenly conceived." And there's a lot of coincidental, evidence like that. But just like anything, the people who've gotten the shot and then actually had symptomatic COVID the week after, and that completely coincidence. They were probably exposed. That was kind of brewing in their system before they became symptomatic. And those reports, unfortunately, always come to light. And then, the media holds on to that, and then the population holds on to that. But I agree with you 100%. Completely disproven and now taken down.
Yeah. Okay. This is a question for you. What typically happens if a mom is COVID positive at delivery and she's a new COVID mom? If she's symptomatic versus asymptomatic? And I'll just start by saying it's going to vary from institution to institution. Yep. Everybody's policy is a little bit different, but just in a nutshell, what is generally done if a mom delivers and she's COVID positive and a new COVID positive, because now we're seeing some that are old COVID positives, then we do the PCR, and we've had multiple testing in a lot of these pregnant patients. And we know it's not an acute infection, which is different, okay? But someone who's a new COVID positive and they're asymptomatic versus symptomatic and they delivered.
Yeah, and I'll sort of split this into two different populations, because obviously as a neonatologist, I see the symptomatic, if you will, the preemie baby. So I'll speak to that very briefly at the end. But I can tell you that the new CDC recommendation or guidelines actually that came out a few months ago now, initially, because we didn't know what was going to happen with newborns, the moms are completely separated. And you can imagine the psychology behind this. I mean, it's already difficult to have a baby. There's lots of emotions. Sometimes moms are going through more than 24 hours trying to, to deliver, maybe have a C-section. So there's there's all that. And now on top, you're told, by the way, we have to separate your baby for 14 days. You're not allowed to even sit, say hello. So that was extremely stressful for a lot of moms. And it wasn't really until sometime sort of middle of last year that they were able to, the guidelines came out, now able to say, you know what, if you do have it, you are now able to room in. And not only that, you're able to kangaroo. Now, the important thing with those, and so we're continuing with those type of situations, as long as the baby is clinically well and mom is well as well, or she's not, she's not sick, she's able to stay with the baby. She's able to kangaroo breastfeed. She still has to wear a mask. She is going to be, usually they state, if I remember correctly, 20 minutes before any contact with the baby, you're washing your hands. Goes back to what we were talking about earlier. Same thing after touching the baby, after breastfeeding, after pumping, you're washing your hands again. So you're continuing to use that mask. But now we're allowing really the family to stay, or the moms to stay with the babies. For us on the NICU side is a little bit different, because unfortunately it's not an issue with the mom and the baby at that point. If we could quarantine them and not have mom leave that room, then that might work out. But unfortunately, we can't have a mom in our NICU. And so in those cases, the mom unfortunately does have to stay away. And they do this for the sort of 10 days that we're looking at. We can allow other family members as long as they're tested negative. Mom, it's a 10-day count from when she was symptomatic with a positive, and also no fever for the preceding 24 hours. So if you have 10 days, no fever, 24 hours, you are now able to go in and visit. We do allow other family members to come in and be sort of the replacement. Usually it's a dad or significant other who's able to now come in and sort of replace the mom, again, as long as they show negative testing. And so that's, again, the NICU is just a little bit of a different world, but for the most part, that's how we're practicing. And you pointed to something really important. Every hospital has a different policy. It also depends if you have individual rooms. We have 97 bed individual rooms, so it's a pretty big hospital. Individuals. If your hospital may be in a form of pods, meaning you have 4 or 5 babies within the room, they may do something different. Not because the virus is different, but of course they do not want to have one mom pass COVID to now 4 or 5 different babies. So that's, every policy is a little bit different, but it depends on the situation.
Right. So so we're done with all the questions I've had. I'm going to go through a lot of questions through here.
Yeah.
Let's see. Okay, both my husband and I are fully vaccinated, but we have 4 kids who are younger. How much should we worry about our kids? Our youngest baby has Down syndrome.
Yeah, it's a great question. So the Down syndrome is actually one of those high-risk categories. Not necessarily, you might have a baby who has trisomy 21 or Down syndrome. They commonly do have heart disease, but not necessarily. So it's just the diagnosis itself. And in those cases, because they are considered high risk, when it comes to the actual nuclear family, so it sounds like this family with the 4 kids, that sort of nuclear family, there is unlikely risk now that you're as a vaccinated adult. There's unlikely risk that you're going to have an asymptomatic carry of this COVID-19 that would pass on to your child, to your baby with Down syndrome, to your child with Down syndrome. The one thing, because we are in that high risk category, this is the one situation where you might have vaccinated parents, your kids may be fine. You do not want to have even vaccinated family members come visit your home because of that high risk that we talked about earlier on. So as far as your regular day-to-day, continue with what you're doing, minimize exposure for your child or your kid with Down syndrome. And again, same thing with vaccinated people coming to your home.
Okay, isn't a variant normal for a coronavirus, meaning it's constantly mutating, hence why we've never been able to cure the common cold? So yeah, I mean, you're going to get variants. What we have to, and there's variants, there's different forms of the flu, right? But we're in a pandemic that I've never seen in my lifetime. I'm sure Dr. Fort has not seen in his lifetime anything like this. So we can't just assume those variants are going to be like the common cold variant or the flu variant. We can't assume that. We have to address every variant the same, because we're in a pandemic where people are still dying, and I don't even know where we're at in the United States. So I hope it's what you're saying and it's just like the common cold and it's not going to be a big deal, but we don't know and we can't assume anything. I think the one thing we've learned about this whole experience being in a pandemic is we cannot assume anything. You know, you have to err on the side of caution because we don't know everything just yet. And it's going to take a while before we get a lot of data, especially the long-term data that people are wanting. Long-term data means long-term, and long-term is a long time. Okay.
Yeah.
So, you know, would you agree with what I'm saying? Like,
yeah, not only that, I would also emphasize that you're absolutely right. That viruses and bacteria, but especially viruses, are really good at creating minor mutations that will change. But keep in mind that a variant that sticks around is usually something that's successful to the virus. The virus is trying to survive. So if it's creating variants, it's creating mutations every second, but most of the mutations are dying because they're not allowing that virus to survive. So if we're seeing variants that are propagating and are actually increasing in numbers, that means it's actually better. It's doing something better and therefore now going to be overtaking the old version, if you will. So that's where we have to be a little bit careful, going back to what you said. We don't know if this better is just a tiny bit better because it causes more infection, but it really doesn't cause hospitalization. Well, maybe that's not that big of a deal, but we don't know. We don't know if this could increase mortality, and that's a big deal.
Yeah. Well, what my mentor said to me, you know, viruses don't want to kill everybody because they can't survive. They're
Yes. Yes.
They propagate, and so they'll make little changes, and so they can get in. You know,
Absolutely.
they want us to hang around. So variants are being made. It's just that in a global pandemic where it hit us like this and killed as many people as it did, we can't take anything for granted. I hope that it's just like we're saying here, and that, you know, there are variants that may not cause a severe disease, but we just don't know yet. And we have to be cautious and wait till we get the information, which hopefully will be, yeah.
Sure.
The Johnson & Johnson vaccine safe. I got it and I'm breastfeeding. What part of the vaccine gets to the baby? So, you know, can I say that any vaccine for COVID is safe in pregnancy? No, but they weren't studied in pregnancy. They're just now being studied in pregnancy. And I'm just going to say this here. I get this a lot because I educate about the vaccine a lot. No, someone told me, messaged me today, no one should be recommending this vaccine to anybody that's pregnant or vaccinated or pregnant or breastfeeding because we don't know, it wasn't studied in pregnancy. My response to them was that we're in a global pandemic. If the CDC came out and said pregnant and lactating women are not allowed to get it, that's called paternalism. That's not allowing our pregnant and lactating individuals to have the autonomy and the ability to make a decision that's best for them, especially since they're considered considered a high-risk population for COVID disease. You can't take that away from them. What we do is we educate it based on what we know about coronavirus, what we know about coronavirus in pregnancy, the infection, what we know based on our knowledge about vaccines in pregnancy, okay? No, I know this was not studied in pregnancy properly or initially, it's being studied now, but you can't orphan pregnant and lactating individuals from a vaccine just because of it wasn't studied in them. That's done way too much and with a lot of therapies and medications in pregnancy and lactation, and that's not fair. It's a global pandemic. Or pregnant individuals are at higher risk for severe. So yeah, we're going to be paternalistic here. Everybody was thrilled when the CDC came out with the recommendations and did not cross pregnant and lactating individuals off the list as they shouldn't have. So people are making the decision based on what they do and do not know about everything regarding COVID infection in pregnancy and COVID vaccine in pregnancy, and they're making the best decision for them. If we'd taken that away from them, nobody would have liked that either, right? So no one's making anybody get the vaccine. I am of the firm belief that no obstetrician should make a blanket statement against it or a blanket statement for it. Each person's individual. You take them as an individual in pregnancy and decide what the risk is, have a conversation for them so they can make an informed decision that's best for them, okay? Yep. For the reasons that I just stated. So as far as the vaccine, what part of the vaccine gets to the baby? If you're breastfeeding and you get the vaccine, if anything, it's the antibodies that get to the baby, right?
That's correct. Yes. Yeah. There's been, from a vaccine standpoint, actually, there's ongoing trials. They're actually recruiting information right now. So we don't know any of what actually happens from an antibody from the vaccine. You talked about one small study, and so we're recruiting more information. Hard to say anything from a vaccine. But if you actually look at the moms who did have COVID-19 and the antibodies and what passed on to the baby, you can see that it's really the antibodies. There's been, I think, 1 or 2 studies that showed small, tiny particles of the virus pass on through the breast milk to the baby, but that cannot cause disease. It's basically chopped up piece of virus that goes in. It cannot cause infection at all. It really is just a chopped up piece that you pick up because of this study. The way we look at these with this, RT-PCRs, they're so good at looking at tiny particles that it does pick up on this test. But from a vaccinated standpoint, we don't have any data, but it's extremely unlikely because even with the infection, it does not pass and cause an infection to the baby, right. Just the antibodies.
Yeah. As far as, I obviously we have the 3 vaccines that are available, the two-dose mRNA vaccines, Pfizer and Moderna, the one that's the adenovirus vector that's used the adenovirus, which is Johnson & Johnson. Just quickly, you get the vaccine that's available to you. None of them's better than either one for pregnancy or breastfeeding. It's not going to change anything. You just get the one that's available to you. And, what we did, actually, there was another study that came out that compared antibody response after vaccine and pregnancy and lactation versus antibody response after COVID infection. And again, it's a small study, but they did find the vaccine response was more robust or a little bit better after COVID vaccination in pregnancy and lactation than actually having the infection during that favorable. Okay, so that's a good study there. Okay, what's the pregnant? What is the best week to get the vaccine? Okay, I get this question a lot too. The recommendation is to get it when you can, when you feel comfortable, obviously, and whenever you can. We have no reason to think first, second, third trimester is better than any one. Again, I reiterate the best time to get the vaccination is when you can get it, and the primary reason is to protect you. Okay, so I know people are wanting to wait. When's the best time so I can protect baby? I don't say that's not how my thought process is. It's to protect you. The one thing about getting the vaccine in the first trimester was the concern about getting a fever. We're getting various reports about, it's one of the more common side effects of vaccination, but you can take Tylenol for that. If you're uncomfortable and you're worried about getting a fever, or if you're someone who's had the flu vaccine or something in the past and you know that your body mounts a high fever response, then you might want to wait to the second trimester. But that's your preference. I know dozens of people who message me every day that are getting it in the first trimester and they end just fine. So, but it's really up to you. Flu deaths this year, I don't know. I've been so, do you know anything about flu yet? I've been so preoccupied with.
No, yeah, I looked into this because actually I had somebody ask me about this, and the flu numbers have gone down dramatically. And a lot of it is because obviously the way we're caring for ourselves, not only is it the social distancing, the hand washing, which are all those things that doctors, and again, I was a pediatrician before I became a neonatologist. This is the one thing we would tell every parent to decrease infection, especially during flu season. You want to decrease it by hand washing, and if you're symptomatic, wear a mask when you go out. So we're basically proving that yes, by taking care of this, it can be done. It can decrease the risk of flu.
Yeah. I mean, I was like, does flu even exist anymore? I'm teasing. Of course it exists. I don't
no, right.
COVID. I'm like, oh.
I know. Yes, so true.
Okay. How confident are we in the science of the vaccine delivery not crossing the placenta, not the antibodies? What is the biggest concern with not fully recommending? I don't know what fully recommending, what you mean by that. So we know, we have a lot of information on getting the flu and the Tdap vaccines in pregnancy. And that's why we recommend them in the third trimester, well, the flu vaccine at any time, but the Tdap particularly in the third trimester for the best protection for the neonate from whooping cough or pertussis in the newborn period. So we know a lot about that. So of course it's not exactly the same, but we do have experience with vaccinations in pregnancy, and we know enough about that. So we know that the antibodies can cross the placenta. As far as everything else specific to COVID vaccine, it's still going to take time to know all the specifics about how the vaccine, how effectively it works, which trimester it works the best in, all of that stuff. The good thing is that we're studying it now, and we actually have the vSafe program, which we have over 60,000 pregnant persons who have gotten the vaccine or gotten pregnant after the vaccine and are registered through vSafe. So we are getting some information from them. So we will, the last ACIP review of vSafe was on March 1st. They should be coming out with another one soon, so hopefully we'll get some more information on that.
Great.
What else? Okay. Somebody was asking me about, as far as assisted reproductive technology, just real quick. I did do a previous live discussion. You can go underneath my Instagram live about how fertility centers are handling those that are going under assisted reproductive technology and timing the vaccine. Every center has a certain recommendation on how they want to handle that. So you can watch that live discussion, or you can go under my COVID fertility highlights and read what ASRM says. They just put out a new updated document a few days ago, or actually last week. So you can get that information there. Okay, Dr. Fort, thank you so much. Do you have anything else you want to add?
No, well, just, you mentioned, for those that are interested, I know obviously everybody has to go through OBGYN at some point. Most people don't ever want to know what a neonatologist is or what the NICU is. But, if you have any concern, any thoughts, if you think you might have a high-risk pregnancy, if you think you may have a chance of getting to know the NICU, and it can be a really scary place, definitely go into social media. You can, follow my handle at NICU Doc. I also have some YouTube videos that you can look at. My YouTube channel is also the NICU Doc, and I have a lot of information on COVID and newborns and some of the studies, but also just how does it, affect babies and so on and so forth. So please, anything in neonatology, follow me. Again, thank you so much, Shannon, so much for the opportunity to come on to your account and your channel. And this was really, really great. You've got some really smart people with really smart questions. So yeah, I'm glad.
I will put Dr. Fort's Instagram handle in the caption of this video, and you can just click on it to get to him there. But I do recommend you follow him, because there's not a lot of NICU neonatologists on social media. So having someone like Dr. Fort that gives you information, especially during COVID times, is great. And I do love his account, so go follow him for all the good NICU and even some not so NICU information. He kind of covers those. So
I try and be baby stuff, and then also just a little fun stuff too. Actually, right now I'm going to be running to my daughter's final. She's playing a soccer game.
Right now, okay. Well, good luck to her, and thank you so much.
Thank you again, Shannon. Have a great one. Bye bye.